Ladies and gentlemen, Chair and co-founder of Us Against Alzheimer's, George Vredenberg.
Congressman LaHood from the great state of Illinois, a member of the Ways and Means Committee, a champion for Alzheimer's policies here in Congress. Thank you for spending a few minutes with us this afternoon.
George, great to be with you, and thanks for all you do in this space. I've enjoyed working with you and your team as we continue our goal of finding a cure for Alzheimer's.
That's the goal. You were the champion of what we call the Change Act, which stands for something. We make up a lot of these words, but it basically would require an objective assessment of cognitive impairment at the Welcome to Medicare visit and in the annual Medicare visit. What do you think is important about early detection of this disease?
Well, the Change Act reflects what we want to do in law, and that's early detection. You hit on this. It's so vitally important that we have early detection for anybody across the country. And unfortunately, we've been very deficient in that. And so what our bill does is looks at ways to make sure that everybody can have that diagnosis. And we were very happy that our bill passed through the Ways and Means Committee early this year in a bipartisan way. And so that was due to a lot of work and progress to get that done. But what this will do is, again, put into law and codify the ability to have that early detection. Because what we've seen by the research and the studies, that when you have that early detection, you can get treatment quicker, we can get diagnosis quicker, and we can help people as they, whether it's caregivers or patients or families, to deal with this.
That's exactly right. You don't want to diagnose cancer at stage 4, stage 1. That's what we need to do with Alzheimer's, and you're a champion of that. So what are the prospects of this bill getting done this year?
Yeah, so we've made progress, obviously, getting it through the committee process. I was proud to champion that along with lots of others on the Ways and Means Committee. And so we're able to get it passed, get it through the House. And so what we hope is that the Senate will take it up in the lame duck session, and then we can get it passed into law. As you know, George, after the election, we'll have a lame duck session in end of November and December. There'll be a lot going on then. We think this is perfect to get passed into law. There's nobody, in my view, or that I've detected, that is against this legislation. And so it's just a matter of finding that vehicle to get it done. But we're going to continue to push, continue to advocate, continue to educate our members in the House and Senate to get this across the finish line.
Well, we noticed that the reauthorization of the National Alzheimer's Project Act, which has really driven research levels of investment over the last 10, 12 years, just passed the House. Thank you very much. Absolutely no objection in the House. Suspension calendar, meaning no one had an objection to the passage of that act. Hopefully we can do the same thing with the Change Act and the lame duck.
That's the goal, absolutely.
Do you have a correspondent in the Senate with whom you talk about this?
There's a number of senators that we've worked with on this. Senator Cassidy has been one that's been a strong advocate over there. Obviously, he's a physician by trade, and so he's been a wonderful partner and advocate on a number of our Alzheimer's-related bills.
Yep, he's the leader of the cause over there. We know him well, so we will make sure that he passes your law.
That would be great, George.
We call it the LaHood Act then. Tell me, NIH funding. You have been a real champion of funding NIH, largest funder of research in the world. And it is one of those jewels of the American crown, so to speak, in terms of the admiration of the rest of the world with respect to the NIH. It is receiving bipartisan support. Now, obviously, the levels of funding is always a little issue, but why do you think NIH is so important?
Well, if you look at what NIH has done for this country, it's really remarkable, George. And sometimes our constituents don't always understand that. But when I go back to my district and talk to my 750,000 constituents in the district, I always, first of all, explain to them what NIH is, National Institutes of Health, but then describe to them the researchers there, the PhDs, the physicians that are there working on tremendous research, Alzheimer's research, cancer research, heart disease, mental health disease, all of these things that unfortunately afflict the United States and many of our citizens here. And so when I look at the amount of money that we've spent through taxpayer appropriations, I've seen the value that's come back to the United States in terms of what that research has done to help reduce many of those diseases, and the statistics bear that out. So I think this is money that has been a good investment. Now, you mentioned about, does it still have bipartisanship? It should, George. But as you know, the debt and deficit comes into a lot of our conversations. We're $35 trillion in debt. We need to be acutely focused on our debt. That's a big part of our job, is making sure we meet a budget. So that complicates it a little bit. But again, I think if you look at the value we've gotten from NIH, and I think Alzheimer's is a good example of that in terms of the progress we've made, statistics bear that out. Again, it's a wise use of taxpayer money to do that. So we saw that obviously during COVID, the investment we made in NIH that had real results for the American people on getting us through the pandemic. So I'm going to continue to be a strong advocate for NIH funding, particularly in the Alzheimer's space. And my gut tells me that when members of Congress are educated on this and they understand the results and the positive medical results that we've had, I think they'll be on board with it. But it's always a challenge when you have a debt and deficit like we do.
Well, one of the great challenges of Alzheimer's is how much it costs Medicare and Medicaid to take care of individuals with the disease and support their families. And of course, family costs are significant and growing as well as you go through the course of this disease. So we are, in a sense, this is an issue you've championed, is that in fact, in order to reduce the burden on Medicare and Medicaid of Alzheimer's care spending, we need a cure. So that in fact, investment in NIH is not only smart for research purposes, it's smart to actually get at the problems that are causing increases in Medicare spending. So,
well, again, to your point, I think it's a very good point, George. We're saving taxpayer money in the long run by investing in this now through NIH and that research. That's ultimately and we've seen that in other things we've done, other examples, but clearly investing this money in NIH for Alzheimer's research is going to pay dividends, because as we have an aging population, obviously, the cost associated with dementia and Alzheimer's when it's too late is going to cost taxpayers a lot of money in the end.
Let me ask you how it is that we ought to assure ourselves that the money at NIH in Alzheimer's research and in other areas is well spent. How do you, as a congressman and a leading figure in the Alzheimer's field and others as well, assure yourself, how do I make sure that the NIH is investing this money well?
Well, I think part of our role in Congress is oversight, making sure every nickel and dime of taxpayer money is spent wisely. And I think what you always have to look at, this applies to NIH, but other federal programs, making sure the money is spent efficiently, effectively, and accountable. In our oversight role on the Ways and Means Committee, we make sure that those dollars are going to the appropriate places, being spent the right way, is not being wasted. And again, that we look at metrics, we look at results, and I think we've seen some real positive results on that. So it's getting that information to the members of Congress that maybe don't look at it the way that we do in our proper oversight role, but reminding them of the dividends that have been paid and how we're saving taxpayer money in the long run.
Well, it's interesting. The reauthorization of the National Alzheimer's Project Act came along with a reauthorization of the professional judgment budgets. These are budgets that are sent to you independently of the general budget, but a professional judgment on the part of the NIH about how much money is needed in order to achieve the goal of preventing and treating Alzheimer's by 2025. Now we've extended our goal to 2035. It will be an interesting conversation that we have started now with HHS and with NIH about exactly what we ought to set as a 2035 goal. Because we've made progress, as you mentioned, significant progress on Alzheimer's as a result of the funding increases that you have been such a champion of up to 2025. But we're almost there. So what do we do for the next 10 years?
Well, we build on our success, George. We build on the success we've had for 2025, as you alluded to. And again, showing the American people, but also my fellow members of Congress, the progress we have made. And as you know, George, every family has been touched in some way by Alzheimer's, by dementia, by this terrible disease. Many members of Congress have seen that, but we've also seen the progress that have been made, that there is hope out there, and continuing to give caregivers and families and loved ones that hope, which we've seen with 2025 is important. So as we look at 2035 and our goals that we have there, I think it's building off that success and continuing to ramp that up at a level that we've never seen before. That's really what we need to do. And that's what we're all engaged in. And I look forward to continuing to be part of that.
Great. You mentioned the success. We have 2 new disease-modifying drugs. And last year, there was some real concern because Medicare was signaling that it wasn't going to cover those drugs. And you were a real champion in moving Medicare to a position almost perfectly of getting coverage for those drugs. And so it is a real testimony to the power of Congress to express its views to a government agency to say this is important. So just walk through what you did last year. And I'll mention on the way to that is that our polling during that fight last year is that half of American voters, half of American adults know someone in their family or a close friend who have had this disease. So to your point about how many millions of Americans, hundreds of millions of Americans feel this disease intimately. So thank you for your championship, but I'm curious as to how you thought about the Medicare coverage issue.
Yeah, George, you mentioned 2 really life-changing drugs that have come into the space that were approved by FDA and going through the clinical processes, which they should. But we met some resistance from CMS related to those FDA-approved drugs. And so we need to push government agencies when we don't believe they're looking at the right information or making the right decisions. And with such a need for getting these drugs into the market and getting to patients, we were very, very frustrated in a bipartisan way by CMS not moving forward. And so we wrote a letter. I think we had 75 members of Congress in a bipartisan way. Yes. I led that effort along with a number of my colleagues to do that and laid out in there the justification and the reasoning for why they've made the wrong decision there. Luckily, they made the right decision. They reversed themselves on that. And now we have those 2 drugs that are being utilized in the market now. And we need to make sure that as many people that want access to them can have access to them. But again, it was a way for us to exercise our power and our objective to be involved in this space. And I would just say, George, we laid out in detail the evidence and the research on why we thought this was appropriate, and they reached the right conclusion.
Well, it wasn't a matter of luck. It was a matter of the will of Congress, because I think in the aggregate of 535 members of Congress, over 1/3 expressed their point of view. And you were a leader to half of that coalition. So we have to thank you for that effort, because otherwise it's only private pay. Otherwise, only the wealthy and high-income middle class can get access to these drugs. But you made them available for all. So thank you for that. And I want to thank you so very much for continuing to be a champion in this space. It's important to the American people, and you're leading bipartisan efforts on this, where you find Democrats who are willing to come to the same place that you are, and you to their part. And this is one of the great strengths I think the Alzheimer's movement has had, is that this has always been bipartisan, always been bipartisan.
Well, thanks for that, George. And I'm passionate about this. Having family members of my own that have been affected, I've seen it firsthand. But also being able to be a leader in this space and continue to move forward in a bipartisan way on the Ways and Means Committee and with a number of my other colleagues is important. Again, seeing what we've done already and the progress we've made and the lives we've saved and the families we've helped and the caregivers we're making to have a better way of life, we can only improve upon those things. And so as long as I'm in the job, I look forward to continuing to be a partner with you, George, and the team and this effort against Alzheimer's.
Thank you, Congressman.
Thank you, George.
You take care.
You too.
Thanks for being with us today.
Thank you.
Thank you, George and Congressman LaHood. After the break, our next panel will discuss the need for an effective biomarker strategy that works in diverse, real-world populations. That's coming up at 2 o'clock Eastern.